Hello class, how's it going? Okay, we continue chapter 8, muscles of the abdominal wall and lower extremity. Okay, let's put this up here a little bit. So the abdominal wall is not supported by bone, which is unlike walls of the chest and the pelvic regions. So the abdominal wall instead supported by broad, flattened muscles. So we always say, hey, strengthen our core, strengthen our core. Well, okay, here we go. Let's start to strengthen our core. A lot of times people say, tighten your core. Heck, a lot of people don't even know what that is. So let's kind of go over that. The abdominal wall is instead supported by broad, flattened muscles. Group of muscles connects the rib cage, right here, and the vertebral column to the pelvic girdle. So a band of tough connective tissue, the linea alba, extending from the xiphoid process, which is here. When you're doing CPR, sometimes that can break, to the pubic symphysis, serves as an attachment for the rectus abdominis mostly, but other abdominal wall muscles, which we'll go over. Contraction of abdominal wall muscles increases intra-abdominal pressure and decreases the size of the abdominal cavity. So the four main muscles that you're responsible for are your external obliques, internal obliques, transverse abdominis, and rectus abdominis. When you think of six-pack, or some of you have eight-pack, that's the rectus abdominis. The transverse abdominis is take your belly button and suck it toward your spine. So if you kind of suck in your belly there, that's transverse abdominis. And then the obliques are obviously on your side. If you have some love handles, the obliques are a little hidden there. All right, so if you look here, here's the linea alba. Here's the external oblique, so the fibers come in this way. And then the internal oblique, the fibers go out. And then you've got the transverse abdominis here. So here's the external oblique, outer surfaces of lower ribs, outer lip of iliac crest. It compresses the abdomen, flexes and rotates the vertebral column. Okay, the internal oblique compresses abdomen, flexes and rotates vertebral column. The thing is that the difference between the external oblique and internal oblique is, let me put it in perspective. Let's say I'm doing a crunch and to the side. If I'm doing a crunch to the left side, I'm actually going to contract my left internal oblique, and then if I go to the other side, the same side, it's my right external oblique. So the external oblique helps me rotate my trunk to the opposite side, where the internal oblique will help me rotate to the same side. If I'm doing a crunch to the right, then it's right internal oblique, left external oblique. So hopefully that makes sense. And then you've got the rectus abdominis, which also compresses the abdomen, flexes the vertebral column. So that's your typical crunch. So this is why you always have a job. People doing core stabilization. I was going to show you this video, but you can look it up. But this guy, he does some interesting stuff here. He gets on here and there you go. It's actually quite impressive, but you don't really have to do this for like that. Okay, so pretty impressive, but I don't, it's very dangerous to get on and off of this stuff, and once you add weight here, but the bottom line is there's other ways that you can safely target your core. So be careful when you do this. The muscles of the pelvic floor, you have two muscular sheets that close off the inferior outlet of the pelvis and form the floor of the pelvis. So the deeper pelvic diaphragm forms the outlet of the pelvic cavity. So you've got this pelvic diaphragm down here, and the superficial urogenital diaphragm fills up the space between that pubic arch. Sometimes when this diaphragm gets weak, we can lead to incontinence, and we have some pelvic pain. And the pelvic diaphragm muscles include the levator ani and the coccygeus. Urogenital diaphragm includes the superficial transverse perineate, bulbospongiosus, and the ischiocavernosus. Now, we don't have to learn the origin insertion of these. We don't have to. We're responsible for that. I just want you to realize that here they are: ischiocavernosus, the bulbospongiosus. There's a central tendon. Here's the levator ani. There's the glute max. and you have the external anal sphincter. Now, what can happen is if there's a tightness in the pelvic floor, then that can lead to a lot of urogenital issues, and there's a specialty of physical therapy, women's health, that can help you with this dysfunction. So if you have pain with urination, pain with intercourse, pain with defecation, you shouldn't have to live with that. You should get some help, and really you want to find someone that is an expert in women's health, but men can go there as well if they have prostate issues or pain with defecation. They can definitely get help as well. So it's not just for women's health, it can also be for men's health, but make sure you go to the right provider and get professional help. Here's a list of the muscles in the pelvic floor here, and these are also found in your book. Now let's go to muscles that move the thigh. So the muscles that move the thigh are attached to the femur and to the pelvic girdle. They are classified in the anterior, medial, and posterior groups. So the anterior group muscles flex the thigh. That includes your psoas major and iliacus. So if you have tight hip flexors, people say that's your psoas major and iliacus. The medial group, this is your groin that people refer to. The adduct the thigh, that's the adductor magnus, adductor longus, and gracilis. And the posterior group, extend, abduct, and rotate the thigh. Those are your glute max, glute medius, glute minimus, and TFL. So when some of you like to foam roll the TFL, it's actually the fascia lata. The muscle belly is actually found a little bit higher up. Oh, who loves leg day, huh? Now, one thing you have to realize is you have to push a lot of weight to get legs like this. So you want to make sure that when you do leg day, you're lifting pretty heavy to get results. Now, if you just want to go for the tone look, then obviously you don't have to lift heavy. But if you remember from your earlier kines classes, or if you haven't taken them yet in biomechanics, you'll learn the ratios of quads to hamstrings, and you'll learn that the body itself is not that efficient. So in order to get results like this, we have to push heavy weight. And most of you don't want to get this big. You just want to probably get toned. So in your later classes in the kines, or in your later classes in your career, you may look at this and say, oh, that's disgusting. Some of this is not natural. Let's be honest here. There's some external supplementation that is helping with this. All right, so here is psoas major. Here's the iliacus. Now the psoas major actually goes up to the spinal cord, vertebral column. So if there's tightness here, it can actually affect your low back pain. So there's some evidence that if you want to get rid of some of your low back pain, you want to stretch the psoas and the iliacus. Here's the TFL. Here is the sartorius, which is the longest muscle in the body. Here's the rectus femoris. So the quadriceps, which is your quads, it has quad meaning four. The four muscles that make up your quads are your rectus femoris, vastus lateralis, vastus medialis, and there's one more that is deep to the rectus femoris, and that's the vastus intermedius. Here's your adductor longus. Here's your adductor magnus. Okay, and here's the gracilis right here. And there's your patella, which is your kneecap, and then here's a patellar tendon or a patella ligament. It is a ligament, but we call it the patella tendon. Okay, because the tendon is what basically attaches muscle to bone here. Okay, ligaments attach bone to bone. So the quadriceps tendon will come right over here on top of that. The gluteus medius is here. The gluteus maximus is here. That's what keeps you upright. When patients have weakness in your gluteus maximus, what they'll do is they'll start to lean forward, or they'll still use the smaller muscles in the back, which fatigue very quickly. So really, there's a lot of research that shows strengthening your glutes can help with low back pain. Absolutely. And then there's TFL, there's the sartorius, there's the rectus femoris, vastus lateralis. There's your IT band that you're trying to stretch with the foam roll, but it's like trying to stretch leather. There's not much give here. So it can give you temporary relief. If you have some discomfort, you can do the foam roll for temporary relief and go out on your run, go play basketball, whatever you want to do, but it's not going to make a permanent change in this fascia. it's just too tight. What you probably want to do is strengthen around here, maybe work the TFL a little bit. The muscle belly is a little bit more forgiving than the axial IT band here. And then your biceps femoris is part of your hamstring group. Now don't get biceps femoris confused with biceps brachii. Brachii meaning arm and femoris meaning femur. So biceps femoris is your part of your hamstring group. Yes, this is the glutes. Here's Ronnie Goldman here, one of the famous bodybuilders. Poor guy now with all the working out. He's actually almost wheelchair bound. He's pretty much destroyed his back working out. But yeah, those are his gluteus maximus, and there's his hamstring group. Biceps femoris, semitendinosus, semimembranosus right there. There's gluteus maximus, there's gluteus medius. Here's the adductor magnus. Here's the gracilis, semitendinosus, semimembranosus, and biceps femoris. So your three hamstrings are biceps femoris, semitendinosus, semimembranosus, and they will help to extend the hip and flex your knee, because look, if they attach here and below the knee, they're going to not only extend your hip, but they're going to also help flex your knee. Now your gastroc, which you know as your calf muscles, actually attaches above the knee, so it can also help flex the knee. The main reason you want to know your origin insertions is if you know your origin insertion, then you can pretty much figure out the action of the muscle. And in most typical cases, remember, the origin stays put and the insertion goes towards the origin. So in this case for the hamstring, if the origin stays put, then it's going to help flex the knee. Here is a chart that actually tells you what each muscle originates and the insertion and the action. Okay, there's the TFL, fascia of the thigh. AB ducts the thigh, medially rotates, that means it goes in, internal, so medial rotation is in and external rotation is out. So you definitely want to go, this is just to reiterate the flexors. The two major groups are flexors that bend the knee and then that extend the knee. So the flexors are your hamstrings, so they're going to take, if I were to give you this angle here, and I'm bending the knee here. Okay, and your three main hamstrings are biceps femoris, semitendinosus, and semimembranosus. The sartorius will also help a little bit, but it's not part of the hamstring. These are your three main hamstrings. Extensors are your quads, composed of four parts: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And so that's the difference between quads and hamstrings. Here are the muscles of the anterior thigh again, and here are the muscles of the posterior thigh again. So these are the quads in the front here. Okay, vastus medialis, vastus lateralis, rectus femoris, there's your sartorius, adductor longus and adductor magnus here. Here's your gastroc, rectus abdominis, external obliques, pectoralis, major, minor is underneath, deltoid, anterior delt, biceps, triceps. The muscle in between the biceps and triceps is brachialis. There's your brachioradialis here, and upper trapezius. So he did a pretty good job of being able to define all those muscles. We call those all the beach superficial muscles. Okay, and then there's the hamstrings, biceps femoris, semimembranosus is like more membranous, thick, and semitendinosus is more tendinous, hence the name. Here's his serratus, here's his lats, pectoralis major. All right, and then here we go. Here is, definitely want to know the difference between hamstrings and quads, so you can see the origin, insertion, and the actions here. So the hamstring, biceps femoris, originates on the ischial tuberosity. So all your hamstrings will originate on the ischial tuberosity, but the biceps femoris inserts on the head of the fibula. That means it's more lateral. The semitendinosus is the proximal medial surface of the tibia, and the semimembranosus is the medial condyle of the tibia. But all three of them flex the leg at the knee. Okay, they extend the thigh at the hip. Remember, you want to know the difference between leg and thigh. A lot of times people say, hey, they point to their thigh and they think that's their leg, but leg, the true definition of leg is from the knee down. Okay. And now your rectus femoris, it originates on the ASIS. inserts in the patella by the tendon, which continues as a patellar ligament to the tibial tuberosity. Right, so you have a patellar tendon, and then it becomes a patellar ligament. And then you've got the vastus lateralis, the vastus medialis, and the vastus intermedius, and they extend the knee. So if you look at the vastus group, they only extend the knee because they actually start on the femur, whereas the rectus femoris will also flex the thigh because it starts on the pelvis, which is the anterior inferior iliac spine and the margin of the acetabulum. Muscles that move the foot, we've got dorsiflexion, which is coming up. That's tibialis anterior. Fibularis used to be known as peroneus, and they just decided to change the name all of a sudden. So it's fibularis longus and fibularis brevis. And then you've got the extensor digitorum longus. Plantar flexion, which is pointing down. Gastrocnemius, soleus, and flexor digitorum longus. Turn the sole medially, so inversion, kind of like you're spraining your ankle. That's tibialis posterior. So when patients are recovering from ankle sprains, we want to strengthen the tibialis posterior. Turn sole laterally, which is eversion. That's fibularis longus and fibularis brevis. So here is the leg. Remember, the leg is from the knee down. Here's the patella. Here's the tendon, and it becomes a patellar ligament, which will attach to the tibial tuberosity here. Here's the gastroc, here's the soleus, there's your tibia. So then you've got a muscle called the tibialis anterior. So tibia, it's located in front of the tibia anterior. You've got fibularis longus and fibularis brevis, and then you have extensor digitorum longus, which will extend the digits here. Okay. If you look on the lateral side of the leg, you can see the tibialis anterior, extensor digitorum longus, fibularis tertius, which is right in here, which is deep to the fibularis longus, and then you've got the calcaneal tendon, or the Achilles tendon, which most of you know. Kobe Bryant tore this, Kevin Durant tore this, Boogie Cousins tore this, Klay Thompson tore this. I mean, Dominique Wilkins. It ended the career of many basketball players. I think only Kobe and Kevin Durant were ones that came back. I mean, Klay Thompson came back, but they're never the same. It's never 100% after that. It is difficult to come back from it, but you can come back from it. Here is the semitendinosus. Semimembranosus is thicker. Here's the biceps femoris. There's the sartorius right here. There's the gastroc. It has a medial head on the medial side and lateral head. This gives you like this turtle shell looking, so if you really want to work your calves, you can get real thick calves. If you want more of the elongated look, you do the heel raises with standing. If you want more girth, that's probably the soleus, which is underneath, so you can do that with the knee bent, and you can do heel raises. But a lot of that sometimes is how much weight you push, and then of course genetics plays a role. Okay, so here's the tibialis anterior. It dorsiflexes and inverts the foot. Gastroc, plantar flexes, so pointing down. So you coming up on your tippy toes, that's gastroc and soleus. You can look this up, the muscle song. I can't play it through YouTube. Okay.